Type 2 diabetes isn't necessarily a life sentence. New research shows that more than a third of people with type 2 diabetes achieved remission completely off medications for 2 years, not through surgery, but through a structured weight loss program delivered in regular GP clinics. I'm talking about the DIRECT trial, published in the Lancet Diabetes Endocrinology in 2019. This was a rigorous 2-year cluster randomized trial that involved nearly 300 people across 49 primary care practices in the UK. Let me break down what they found, because these results fundamentally challenge how we think about type 2 diabetes. The core finding: at 2 years, 36% of people in the intervention group achieved remission, meaning that their HbA1c was below 6.5% without any diabetes medications. That's down slightly from 46% at 1 year, but still remarkable. In the control group receiving standard care, just 3% achieved remission. Now, here's what really matters from a lifestyle medicine perspective. Remission was directly tied to weight loss. Of those who maintained at least 15 kilograms of weight loss, 70% remained in remission at 2 years. Even maintaining 10 kilograms of weight loss gave people a 64% chance of remission. The intervention itself was straightforward but structured, and this is crucial. Participants started with what's called total diet replacement. That's 825 to 850 calories per day using formula diets for 12 to 20 weeks. Then came stepped food reintroduction over 2 to 8 weeks, followed by structured monthly support for weight maintenance. All anti-diabetic medication and all blood pressure medications were stopped at the beginning, under medical supervision, of course, with protocols for reintroduction if needed. Here's what this means for you, whether you're a clinician or someone living with type 2 diabetes. This isn't about finding the perfect macronutrient ratio. The companion umbrella review, also published recently, analyzed 19 meta-analyses and found that no particular diet composition, low-carb, Mediterranean, high-protein, vegetarian, showed advantages over others for weight management. What mattered was achieving and maintaining substantial weight loss. The mechanism is elegant. Losing ectopic fat from the liver and pancreas restores insulin sensitivity and pancreatic function. It's reversing the pathophysiology. From my clinical background, I see that structured support and relapse management is essential for sustained weight loss. The DIRECT program built in monthly check-ins and rescue plans for weight regain. About half the participants needed these rescue interventions over 2 years. And that's not failure, that's just realistic long-term management. The broader health benefits extended beyond diabetes control. Blood pressure improved, triglycerides dropped, and quality of life increased. Fewer serious adverse events occurred in the intervention group during the second year. The takeaway: type 2 diabetes, particularly within the first 6 years of diagnosis, is potentially reversible through sustained weight loss of at least 10 kilograms. This needs structured support, not just dietary advice, and it works in regular primary care settings, not just specialist centers. For those interested in exploring this approach, discuss with your GP about evidence-based weight management programs. The evidence is clear: remission is possible in type 2 diabetes. Subscribe to MedHeads for more evidence-based health insights that actually work.